In today's video, we will be diving into an often overlooked test known as T3 uptake. It's also known as resin uptake or T3RU. T3 uptake is not exactly a thyroid hormone lab. Instead, it measures how well your body's thyroid hormone binding globulins are functioning. These globulins are proteins that are essential for carrying thyroid hormones through your bloodstream, making them available for your cells to use. In the last 6 videos, we learned how your thyroid hormones can give insight into other areas of your health, how your body knows how much thyroid hormone to produce, what the TSH, T4, and T3 lab values can tell you about your thyroid function, how to know if you are a good converter from T4, the stored thyroid hormone, to active T3, the thyroid hormone that is usable by your cells. Also, some insight into how the thyroid labs can be a warning of what's happening in your gut, your liver, your kidneys, other hormones, as well as a warning of chronic infections lurking in your body that are being overlooked by your immune system. We also learned how even if the labs that are being checked by your doctor are normal, then sometimes there are labs like reverse T3 that are not even being checked, causing critical information to be missed. The T3 uptake test does not directly measure thyroid hormone concentrations. Instead, it indirectly reflects changes in thyroid hormone binding protein levels. So remember when we learned that most of the T3 and T4 are bound up to proteins, and only a very small percent of the thyroid hormones are freely floating in the blood. The T3 uptake test is really looking at those proteins. Some patients may have a deficiency in those proteins the hormones attached to. This is important to determine since that is how the body maintains a stable pool of thyroid hormones in the bloodstream. If you are deficient in these proteins, then existing thyroid hormone levels would be depleted quickly. So in hyperthyroidism, there is more T4 in the bloodstream, so there are fewer protein binding sites on thyroxine binding globulin available. We will call thyroxine binding globulin TBG for short. Less TBG correlates with a higher T3 uptake level. In hypothyroidism, or when there is an increased concentration of TBG, then there is less T4 available, or there are more binding sites on TBG available. This correlates with a lower T3 uptake. T3 uptake helps determine if your symptoms are due to a problem with thyroid hormone production or your body's ability to utilize available thyroid hormones. Normal reference ranges for T3 uptake vary based on the lab performing the test. A typical normal range can be 24 to 39% for adults. I've seen 28 to 38%. I've seen 25 to 50%. Reference ranges also vary even more broadly for children based on the age, so you want to check with the lab and see what their reference ranges are. Falling within normal range for T3 uptake typically indicates adequate binding capacity of thyroid binding proteins and balanced thyroid hormone levels. Even if enough hormones are being produced by your thyroid gland and your blood levels for T3 and T4 appear normal, your body might still struggle to utilize these hormones if the binding proteins aren't functioning properly. This test helps reveal if there's an issue with these binding proteins and provide another clue as to why you still have hypo or hyperthyroid symptoms, even if your other lab results are falling within normal ranges. So factors affecting T3 uptake can include so many things. Of course, thyroid disorders such as hyper and hypothyroidism, also liver disease, including cirrhosis, which affects the synthesis and metabolism of thyroid binding proteins. Also renal dysfunction, such as nephrotic syndrome, which can alter the clearance of thyroid hormones. Pregnancy and estrogen therapy, such as oral contraception or hormone replacement therapy, which increase thyroid binding proteins and decrease T3 uptake. Consuming foods with phytoestrogens, such as soybeans, flax seeds, and lignans found in grains and other foods. exposure to xenoestrogens found in plastics, herbicides, epoxy resins, and more. There are certain medications or drugs, such as opiates found in narcotic prescription pain medications, or opiate street drugs like heroin and fentanyl has become increasingly popular. Other drugs like tamoxifen, nicotinic acid, furosemide, non-steroidal anti-inflammatory drugs like aspirin or ibuprofen, glucocorticoids like prednisone, anti-seizure drugs like phenytoin, also androgen therapy, heparin, and more. Chronic constipation can also affect T3 uptake because it prevents the body from properly eliminating excess estrogen. It can also be due to genetic conditions. So the goal here is to figure out what is causing your problem so you can correct it. Is it a poor diet with lack of nutrition leading to vitamin and mineral deficiencies? Or is it a lack of sleep or exercise? Is it too much stress? Is it a chronic infection in the body being overlooked by your immune system? This infection can prevent the body from absorbing critical nutrients in your food, even when you're eating good and healthy food. It can also place the body under tremendous chronic stress. So it could also be too much caffeine or nicotine, other toxins being built up in your body that your body's being exposed to, or hormone disruption. Usually it is a combination of more than one thing. Taking a systematic approach to improve your health is where you will be able to reverse the barriers preventing your thyroid and your body from expressing itself in a healthy way. So next week we will be discussing lab tests that you can use to determine if your thyroid issue is caused by an autoimmune condition. So you will find out how to know if your own immune system is attacking your thyroid. Autoimmune is the most common type of thyroid disorder, whether it's Hashimoto's thyroiditis or Graves' disease. If it's an autoimmune disease, then it is usually just a matter of time before your immune system begins attacking other body parts as well, if the immune system is not corrected. So once the immune system starts misfiring towards one type of healthy tissue, in this case the thyroid, it will likely start misfiring at other healthy tissues and may have already started. That is what happens when it attacks your joints or your gut, such as rheumatoid arthritis, celiac disease, ulcerative colitis, Crohn's disease, and so many other autoimmune diseases. What is even worse is once the immune system is misfiring and busy attacking healthy cells, it won't be busy attacking what it's supposed to attack, like chronic infections the immune system is no longer paying attention to. These infections can be parasites, bacteria, fungus, virus, mold, and other pathogens. It also will not be attacking the unhealthy cells that could turn into cancer. This zaps your body of energy, and it leads to chronic inflammation and pain, and can ultimately put you at increased risk for developing cancer like I did. I'm so excited to share this with you because I believe if I had learned this information 20 years ago, when my thyroid problems were still early, I could have, of course, corrected and avoided my thyroid cancer and helped remove barriers that were preventing my thyroid from healing. I could have avoided many other autoimmune diseases that I developed as well and avoided a lifetime of hormone replacement as a result of having my thyroid removed. This is why I do this. I want to help you avoid what I went through. I would love to hear back from you if you are having any questions and to know if this information is helping you better understand your thyroid. Feel free to check back in the previous videos in the series and find the extensive list of symptoms in the document handout included in the links in the description.